Lactase deficiency, otherwise known as lactose intolerance, is characterized by the absence of the enzyme lactase in the intestinal brush border, resulting in the body's inability to fully digest lactose and dairy products. In this video, I'll give you my visual mnemonic to help you remember the pathology, symptoms, diagnosis, and treatment options for this disease. What are you waiting for? Let's get started. First, take a look at this gigantic jug of milk on the countertop here. It looks like our scene is centered around a father and son making dessert together. And what goes into almost any type of baked good? Milk, duh. For this image, we'll use milk to symbolize lactose, since, well, lactose is found in milk. In this particular context, it's here to help anchor you to both lactose and the disease, lactase deficiency. Get it? Lactose for lactase deficiency? Next, notice these sugary cubes stacked on top of the stove. Where have you seen these sugar cubes before? Yep, that's right, in the scene on galactosemia. In that scene, our galactic fox was binging on galactic sugar to the point that it made him sick. As you may have already guessed, this galactic sugar from space is our recurring symbol for galactose, or galactic sugar. This galactic sugar should help you remember that lactase breaks down lactose, a disaccharide, into galactose and another product, which we'll be discussing shortly. Now shift your attention to these bags of sugar here. They look pretty full to me. These sugar bags are here to help you remember that lactase normally breaks down lactose into galactose and glucose. However, because these bags are full to the brim with sugar, we don't need any more sugar. This should help you remember that in lactase deficiency, lactose can't be broken down to glucose and galactose, which means that we won't be having any more of that galactic sugar or glucose sugar to make our sweets. Makes sense, right? Lactose itself is a poorly absorbed disaccharide, which means that it's really important for the body to digest it to simpler, digestible components like glucose and galactose. Glucose and galactose are simple sugars that can be easily absorbed by the intestine. Next, take a look at our bendy straw over here. This bendy straw looks mysteriously like the intestinal brush border. Yep, that's right, this bendy straw should peg the intestinal brush border. Just look at all those villi. Anyway, this bendy straw should help you remember that lactase is an enzyme that normally operates in the intestinal brush border. In lactase deficiency, lactase can no longer be found in the brush border, and so lactose remains unabsorbed in the intestinal lumen. Makes sense, right? Now let's take a step back to think about the symptoms seen in lactase deficiency. Notice how the dad's backside is covered in chocolate milk. Looks like his son accidentally spilled some chocolate milk on his dad. His dad won't be too happy. But chocolate milk on the backside should help remind you of diarrhea. Let me explain why this happens. Because lactase is missing in the intestinal brush border, all of that lactose gets unabsorbed by the small intestine. Lactose is an osmotically active molecule, so its presence leads to poor water absorption. In other words, high lactose concentration in the intestine creates an osmotic effect, which, as you may recall, is the movement of water from low solute to high solute concentration. This osmotic effect leads to, what else? You guessed it, diarrhea. In addition to this, lactose passes on to the large intestine and is fermented by colonic bacteria, causing lots of gas production. Both the osmotic diarrhea and the lactose fermentation lead to classic symptoms of bloating, flatulence, and diarrhea. Not pretty symptoms, but hey, we all get them from time to time. Now that we've gone over the pathophysiology of lactase deficiency, let's quickly review the different types you might encounter either on test day or on the wards. Take a look at our older dad's bent back as he tends to his dessert. The fact that he's older should help you recall primary lactase deficiency, which causes age-dependent decline. Another way for you to remember this is that our older dad is bending over. Get it? Bent back for age-dependent decline? Age-dependent decline is caused by the absence of the lactase persistence allele. In individuals without the lactase persistence allele, less and less lactase is produced over those individuals' lifetimes. By the time they reach adulthood, they're no longer able to produce lactase, and that results in lactose intolerance. So in summary, patients with a missing lactase persistent allele would not be lactose intolerant as children, but would be lactose intolerant as adults. Another really important point for you to remember for primary lactase deficiency is that on biopsy, you'll typically find normal intestinal mucosa. This is simply because the enzyme lactase is absent from the brush border, resulting in no actual damage to the brush border. So which ethnic populations are most affected by primary lactase deficiency? Well, take a look at the young child spilling chocolate milk on his dad. This young child is of Asian ancestry, and this should help you recall that Asian populations are disproportionately affected by primary lactase deficiency. Additionally, African American and Native American populations are at similar risk of developing this type of lactase deficiency, although this is a minor point and is not as important for you to remember for test day. Now let's talk about the second type of lactase deficiency, unsurprisingly called secondary lactase deficiency. Take a look at this fire here that's being used to heat the galactic sugar. It looks like this fire is pretty inflamed, right? This inflamed fire should help you remember intestinal inflammation, which is the cause for secondary lactase deficiency. Another way for you to remember intestinal inflammation is gastroenteritis, which is sometimes caused by rotavirus infection or autoimmune disease like inflammatory bowel disease. Since the intestine is actually inflamed in secondary lactase deficiency, mucosal damage may be seen on biopsy. The third and final type of lactase deficiency we're going to mention is congenital lactase deficiency. In this type, the infant is born with the absence of the gene encoding lactase. As in primary lactase deficiency, congenital lactase deficiency will show normal mucosa on biopsy because lactase is just absent from the brush border. There's no intestinal inflammation that's leading to mucosal damage here. However, don't spend too much time remembering congenital lactase deficiency because it's a pretty rare condition and it isn't super high yield on step 1. So how do you diagnose lactase deficiency? Recall how we mentioned that bacteria ferment unabsorbed lactose, creating gas. A byproduct of this fermentation is hydrogen ions, and this results in decreased stool pH. The chocolate milk on our dad's backside should also help you peg acidic stool pH to osmotic diarrhea. Next, take a look at how our dad is blowing on the fire. I guess it's really hot and he kind of wants to make sure that the galactic sugar is being warmed at just the right temperature. This blowing motion should help you remember the lactose hydrogen breath test, which is another diagnostic test you can use to assess for lactase deficiency. Makes sense, right? Finally, let's discuss our treatment for lactase deficiency. As with any other enzyme deficiency, it makes sense to avoid dairy products to minimize consumption of lactose. If a patient is lactase deficient, the most suitable dietary modification would be to opt for lactose-free milk. Yes, it doesn't sound particularly appetizing, but it does exist. Another treatment option would be to add lactase pills to the diet, which is literally just a supplement that contains the lactase enzyme. In other words, this is an enzyme supplement. Okay, I'm getting kind of hungry thinking about milk and sugar. Let's do a quick review before we call it a day. Lactase deficiency is caused by the absence of lactase in the intestinal brush border. It results in the body's inability to digest lactose into its two components, glucose and galactose. The buildup of osmotically active lactose creates an osmotic effect in the intestinal lumen, causing osmotic diarrhea. And since lactose is fermented by colonic bacteria, it can also cause bloating and flatulence. There are 3 types of lactase deficiency: primary, secondary, and congenital. Primary lactase deficiency is most common in Asian, African American, and Native American populations and results in age-dependent decline of the lactase enzyme. Secondary lactase deficiency is caused by gastroenteritis, particularly in the context of a rotavirus or autoimmune disease. In both primary and congenital lactase deficiency, you'll see normal mucosa on biopsy, and in secondary lactase deficiency, you'll see damaged mucosa on biopsy. 2 ways to put lactase deficiency on a differential would be to note acidic stool pH and the lactose hydrogen breath test, both of which are due to lactose fermentation by colonic bacteria. Well, I hope you enjoyed this video on lactase deficiency. On to the next one.